Dr. Acey, featuring Dr. Michelle Ober. Today's show covers how to talk to your doctor. I'm your announcer, Barbara Glidden. Let's start the show.
Hello, I'm Dr. Alicia Acey. Welcome to the premiere episode of Feeling Groovy with Dr. Acey. I'm a clinical psychologist with over 15 years of experience, and I am blessed to have a career that I truly love. I've had the privilege through my work to know what questions are truly in the hearts and minds of my clients, and I believe the general population. Through my work, I have really learned what the questions are that we have about our world. The things that are unique about us, the things that are different, but really it's about you and the questions that you have about our world. And I mean the day-to-day world. And now I'd like to tell you a little bit about myself. 9 years ago, after giving birth to my son Jacob, I had the opportunity to watch a little bit of daytime television, which for those of you who work full-time, I think can understand that that could be a really rare occurrence. I had the opportunity to see Kelly Ripa. She was a talk show host. She kind of inspired me, and I realized I wanted to have a talk show. I really wanted to have a talk show. But a lot of things changed in my life, and things happened, including twins. And by the time I came up for air, which was, by the way, last holiday season, I decided I'm going to make this dream happen. And I decided to post one reason every single day on my Facebook page that I should have a talk show. And I don't use the S word lightly. And I made good on my promise. And I couldn't believe it. Some amazing responses came, mostly this talk show. But I'm going to talk a lot more about that in the future. Right now, I'd like to introduce you to some really groovy people that are a huge part of this show. And the first one is my announcer, fact finder, and researcher, Barbara Glidden.
Thank you.
And Barbara's going to be behind this desk on C3PO, my computer. A lot of times posting things on our website, taking questions from viewers, and really helping to connect with the questions that are in your hearts and minds. Right now, I want to know a little more about Barbara, and I think we should all get to know her better. So tell us about yourself.
Well, my name is Barbara Glidden. Like you said, I am going to be here announcing the show for you and doing all the fact-finding, which any information that you guys want to know, I'm going to be right here on C3PO, plugging it in. Just a little about myself. I am a CPR instructor and first aid instructor, and I'm a mother of 3 teenagers. I'm married to my husband for 18 years, and I'm just really excited to be here and learn all about you and this show and give back to our community.
You know, I think we've got a lot to learn from you. I think CPR is so important, and I hope that in a future segment of the show we can do a lot of work with CPR and really help people learn the most important things about that.
Well, that sounds real fun.
If you're in, I'm in.
I'm in.
All right, so I hope that you'll come back after the break, and we are going to have Dr. Michelle Ober, a local pediatrician who is going to talk to us about the best ways to communicate and connect with our doctors and feel groovy. Hi, welcome back to Feeling Groovy with Dr. Acey. I am so excited to have the privilege to introduce you to Dr. Michelle Ober. Dr. Ober is here today as a guest, but she's going to be the ongoing medical professional advisor for our show. And I'd like to tell you a little bit about Dr. Ober, but first I have to confess that she is one of my lifelong friends, and I could not be happier to have her here with me today. She is a graduate of Wayne State University Medical School. She completed her residency at Beaumont Hospital locally, and she was the chief resident during her residency, which is very impressive. She also is has a master's degree and is a nurse practitioner, so she's really knows a lot about all of the aspects of the medical community. And I'd like her to tell you a little bit about herself.
Thank you, Alicia, so much for having me here. It's an honor and a privilege to be on the show with you. And again, my name is Dr. Michelle Ober. I'm a pediatrician. I have a private practice out in Commerce. I work with 6 other pediatricians and a physician's assistant. I'm also a wife and a mother of 2 young children.
Thank you so much for being on the show, and I think you're going to have a lot of insight for all of us to learn from. But mostly, the first question I want to start off with is, what do you think people should do to prepare when they're going to see the doctor?
Well, I think it depends on the circumstances in which you are going to the doctor. If it's your first visit to a new doctor, if you're transferring from one physician to another physician, make sure you have all your records with you and bring them with you or have them sent ahead of time. At least that will give the physician a little bit of time to review everything and be prepared. If you're going into a visit, the visits are scheduled only for a certain amount of time. So if you come with a load of things with you, you may not have time to go over everything with your doctor.
Well, that's great advice. I'm somebody who always requests my records whenever I go to a doctor, whenever I have tests done. And I don't think most people know that they're even allowed to do that.
Yes, absolutely. Your records belong to you, so you can request anything that you want. Copies of films, if you get x-rays done, CT scans, MRIs, anything like that, you can get them put on a CD and take them with you. You can get copies of anything also, paperwork for yourself. So do you
think that it's better to send it ahead of time then, if you think that, if you're saying the doctors have a specific amount of time set aside?
If you have a chance.
Are you really going to spend the time ahead of time looking at it?
It depends on the circumstance. If it is a normal, healthy, well child, for instance, that's coming in and transferring practices, there's not necessarily a need. You can leaf through the physical exams very quickly, leaf through immunizations, and catch up quickly. If it is a child who has a chronic medical problem, it is definitely a good idea to send everything ahead of time. Call the office, let the physician know ahead of time that you're coming in, you're going to be transferring, new patient, these are the issues you've been dealing with. You sent everything ahead of time just to give them the heads up before you go. And that way, when you step into the office for the first time, you're not going in with the physician not knowing anything about what's going on.
Because I think that's important to walk in and feel like somebody knows that you're coming in and what you're going to be talking about. Okay, well, I guess that kind of leads me into another question I have, which is, when you meet with the doctor for the first time, what kind of information do you think helps a doctor guiding with a diagnosis?
Well, again, it depends what you're meeting with them for. If you're coming in, for example, with a pediatrician's office, and it's a new baby, really the most important thing that we need to know is the history of the mother at that point, how the delivery went, the pregnancy went, and all of those things. And then we start off with the new baby.
Do you want to meet with the parents before the baby is born?
You don't necessarily have to. A lot of times, depending on where you deliver the baby, the pediatrician will already have seen the baby in the hospital. So they already have seen the records of the mother. They know a little bit about the baby before the baby comes, and that way you have a little bit of information. If you are coming in for the first time to see a physician for a new visit, then the most important thing is to come with all of your questions that you have. Come with everything prepared. As much as you can. Now, the physician is also going to elicit some questions from you that may surprise you, and actually something that you never thought of that may lead right to the diagnosis.
What would be an example of something that could be surprising?
It completely depends on where you're going and what the problem is. So you may not know. One thing that people are often surprised of is, their personal histories and things like that. So be prepared for questions about your personal history, private information, and be ready to answer them. And the most important thing with that is to answer them truthfully, because sometimes that can lead to the answer and to the diagnosis.
So if I'm a new mom or moving to a new town and I need to find a new pediatrician, that's pretty overwhelming.
It is.
What's the best way to go about doing that?
One thing that you can do is ask your pediatrician before you leave if they know anybody in the area. Sometimes pediatricians, where they have gone to medical school, know people that have moved, or people that they went to medical school or residency went, and they will refer you to their friend or a colleague that they've met at a conference or something like that.
And if you like one doctor and they are connected to another, that's a good could be a good fit.
Right. Another thing you can do is when you move, if you know somebody in the area, ask them. As you start meeting friends in the neighborhood, ask the friends in the neighborhood that you meet. Ask your neighbors, because they're going to probably go to the pediatricians that are in the area. And if you have a young child and you're going to be running to the pediatrician quite a bit, especially with a new infant.
Or twins.
Or twins, you're going to want somebody close. So you're going to want somebody in the area. And then you can also interview a little bit. You can go to the office and ask to do a meet the doctor visit.
That's what I wanted to know about, because even, I mean, all that is great and it gets you in the door, but then what do you do? Because I think who's not going to be nice to a new client?
Right.
How does somebody know they're comfortable?
You just have to go with your gut feeling. It's the same kind of thing that I tell parents: use your mommy instincts or your daddy instincts. If you think there's something wrong with your child, don't sit on it. Definitely bring them in and tell us what you think is wrong. If you walk into an office and you get a feeling that this is just a comfortable, nice place to be.
How do you know you're comfortable? What are the things, what would be some guiding things to look for?
Well, I mean, it's just when you meet someone, if you meet someone and you feel like this is somebody I would want to be friends with, you just go with your instincts. If you go into an office and you feel like this is a place that I think I could be comfortable bringing my child, if you go into an office and the office staff is not friendly and you just get a feeling.
So the office staff would be
That's the first thing, yes. The office staff, it's very important in any office, and any physician knows this. This is the first people that greet the patients that are coming in. So it's very important to have a good office staff. And then you'll also meet the nursing staff and the assistant staff, and you'll meet the physicians.
So
if you are comfortable with them, correct, and you think that they're nice, they're fine. If you decide to try that office out and you go there and you don't have a good experience, you never have to stay. You could always switch. But you should also let people know. Every office has an office manager. And you should also let them know. People do have off days and things get busy, and there are emergencies in offices.
See, that's a hard one too, isn't it, to know whether it's just somebody's having a day, which we all have.
Correct.
Or if it's an ongoing problem. But I guess that makes sense. If you communicate with the office manager, they'll keep a record of that and maybe can help.
Right. And as an office, we like to know about those things because we cannot correct them unless we know. And sometimes we don't know if something happens in the front unless you as a patient would tell us.
Now that makes a lot of sense to me. I wonder also if when you're bringing your kid in for the first time, and part of the read is the parents. Like, I know sometimes I'm comfortable with somebody.
Right.
But I can tell that my kids are less comfortable with different adults. And mostly it's got to be them that's very comfortable. So do you think it's important to prepare the kids before they come in and meet a pediatrician?
Yeah, well, that's a great question. I do. I think it is important to prepare your children. And, you know, it's a hard question, especially when it comes to immunizations for young children. Do you tell them before they come, or do you not tell them until they get there? And sometimes not telling children, and then all of a sudden when they come in, especially before kindergarten, if they're getting 4 immunizations, to bombard with them with that can be terrifying.
Well, so I mean, Barbara, you've said you've got older kids.
I do. And
so it's been a while from the immunizations, but what did you do?
Well, I just took them to the doctor. I had 3 little kids, and they all went to the doctor, and that shots weren't really an issue for me. But I do have a question about my 16-year-old not wanting to go to the pediatrician anymore. And you know, am I to continue on with the pediatrician, or do I move them to a family doctor?
When do they get kicked out?
I feel comfortable leaving with the pediatrician because that's who knows him.
Right. Well, it's a difficult question. I mean, you know, pediatricians, and depending on the office, in my office in particular, we will see some kids all the way through college, because when kids go off to college, there's no real particular person for them to see. They go to health services, but then they come and they go home and they get sick. So we will follow some of them throughout college. But if they're getting uncomfortable, 16, 17, 18, some internal medicine physicians will see them and start to take over their care. So if you find an internal medicine physician that will see a child at the age of 16, 17, and they're uncomfortable coming into the pediatrician's office because there's a lot of little kids running around, there's babies, there's crying, toys, and they just don't want to be there, they should be comfortable in the office also.
And well, my son, he just had to recently go to the doctor, and he's 5'10" and 200 pounds, and he just feels so embarrassed being
a big baby.
Pediatrician. But I like him to be there because that doctor knows him. And
well, you like him to be there.
Yeah, and so I do. I do like him to be there. I am going to try to keep him at the pediatrician as long as I possibly can.
Yeah, and most pediatricians treat at least through 18. A lot of them up through 21. So you know, it's really his comfort level.